Welcome to Stable and Grounded. We're so very excited to welcome people to our property and get to experience the magic of equine-assisted therapy. We've put together a few frequently asked questions to try and help people understand what it is and what we're about, and just to give people a little bit more informed information so they can make their decision. We are very excited to welcome people here to our property and introduce them to the horses, which hopefully you can see here in the background. So we have 3 of the ponies here who you can get to meet. And look, we really just wanted to jump on and just convey a little bit of kind of myth busting and a little bit more information. We are so very excited to have people come out and get to experience the horses and the amazing thing that equine assisted therapy is. I myself have never truly seen anything else that kind of even comes close to what it feels like to be able to come, to be able to learn some skills, to be able to kind of process that, understand what that may mean for you, and then be able to walk away and apply that to your everyday life. It really is just so powerful. It's so impactful, and it just really, the only word I have to sum it up is magic. We do a little bit of equine-assisted mindfulness, and one of our horses actually, she will actually match a breath with you. And it's just so powerful to see that relationship. And sometimes there's so much that just doesn't need to be seen, because there's experiential therapy where you can kind of be there, you can get that immediate feedback, you can see that what you're bringing is kind of mirrored back in these guys. They're just such incredible creatures, and we really can't wait for you to come out and experience what it is we've got to offer at Stable and Grounded. Looking forward to meeting you soon. Talk about equine-assisted therapy and explain a little around what is it. It's really something that you need to experience and feel to be understand what the benefits are, and I guess really get the gravity of what kind of benefit it can be. So I thought maybe the easiest way would be to record a few things that are our commonly asked questions. So equine-assisted therapy is therapy in the presence of horses. It's done outdoors most of the time. It's done with a therapeutic goal in mind. So myself, and I guess how we sometimes get some perceptions around what some of the myths out there are. So equine-assisted therapy, I'm a qualified therapist myself, mental health clinician, so I am able to do it as therapy and qualified to do so. We do have equine-assisted skills, which is run by someone else, where we around what the skills you can get from activities directly with the horses. So they're 2 different things. I guess one gets a little more into mental health therapy for the diagnosis. We can't do diagnosis ourselves based on what our qualifications are, but we can work with your treatment team on those recommendations. We are located in Pine Mountain. We have 4 horses here. We cater for all ages, so we can do children, we can look after preteens, teens, adults. I think there's even some research around equine-assisted therapy and dementia. I myself am currently doing a scoping review on whether equine-assisted therapy is impactful for domestic and family violence survivors. So there's many different cohorts, so I guess probably one of people that could benefit. I guess one of the main things I would say, they say that the success of therapy is attributed, the success of therapy is 60% attributed to the relationship with the therapist. So here, I guess we have the horses and myself who kind of facilitates that process. So it's really good for people who have not really had success engaging other ways, or may be less apprehensive to open up about that. There's support from psychiatrists that I've met who've said, kids don't want to sit in a room, they don't want to be confronted, they don't want to kind of go through that awkward process of trying to break down those kind of barriers when engaging with someone. sometimes I say that people can come out here and they can just spend some time with the horses, and what potentially they may get out of that might actually just always stay between them and the horse, and they don't always necessarily have to come and repeat that back to me. We do a debriefing at the end. So what you can expect from a typical session is we will run through a safety briefing, run through confidentiality, the same as you would in any other kind of counselling scenario. And then we would look at what your needs are and what you're hoping to learn and hoping to gain. And then what we would do is we would do a little bit of an activity. So the different activities, I guess, are based on what your therapeutic goals are and what you're wanting to achieve, what you're wanting to learn. So we would do a little activity, and then we would look to break that down and debrief it at the end of it. So we can offer some corporate programs. There's an excellent, some leadership activities. It's also a great kind of environment that we've got here where you can be outdoors, engage with the horses. Sometimes, you can even work through a little bit of mediation if need be. We offer employee assistance programs. The reason that I wanted to offer that is I thought there's potentially some, whether you want to say certain industries or potentially you might have a staff member that's not engaging in your employee assistance program. We thought this might be quite a unique alternative to that space to give people the chance to engage and get the benefits from equine-assisted therapy without necessarily, I guess, needing to do that where you kind of book in and you either join a Zoom consult or you need to go into a room, and then it's just a little bit awkward and people are just not sure about opening up or where the trust is or where the safe space is. So we wanted to allow that to be something that people can experience, or we could do, we offer telehealth sessions as well. Also acknowledging that the therapist has to be the right therapeutic fit. We have a few other people that work for us as well that we can look into for telehealth sessions. Do we offer riding? We don't offer riding at this point. I've ridden most of my childhood, and it wasn't until I kind of slowed down and started to kind of follow this path and understand the unique benefits of the groundwork and the relationship that you can have with the horse, where I felt like I really started to progress in that relationship and understand the power of equine-assisted therapy. So at this point, we are offering ridden work. There are other providers around who do offer the ridden work. So it just really depends needs. We do ask that parents stay on the premises for their children's therapy session. We prefer that not be an earshot to give children the opportunity to be able to engage and feel safe to do so, and fully engage in a session. So we have an area where you can sit down in the shade while that session is going on. All the normal confidentiality rules apply. And you can just walk away immediately with tools that you can apply to your everyday life. And I think, I've been there myself where you've gone into rooms and you kind of, you want to talk about a little bit of CBT, or you want to talk about some different kind of methods, and, it might take 10 weeks before you learn some kind of session, or you feel like everyone's just telling you to breathe. This can kind of show you exactly what that looks like when you actually apply those skills. And it's less of a kind of explanatory kind of process and demonstration. You can just be here in a natural environment. You can try it out with the horses, and then you can immediately take that skill home with you. So we are trauma informed here, and try and always understand what our clients need is. If there's something kind of unique about yourself or your condition that you feel like would give you the best outcome and the best chance of success in trying this, we would love to know a little bit about that. You might say that you don't like the wind, or that can be a trigger for you. We would like to know that, especially the same goes for children who have specific sensory profiles, so that we can kind of cater to that and set the environment up for success. Some different kind of activities might involve, some leading, and we kind of go through what that might look like. We can do brushing, we can do some saddling, we can do some herd observations where you might be a little bit further away, and it might actually work if you're not entirely that confident around the horses, because you don't have to get close to them. So you don't really need to have any experience with horses. We can show you, we can talk you through it. We've had people engage who are actually scared of horses and have really wanted to, I guess, sort of challenge themselves and work through that, because they can recognize the benefits. Hey, are you going to smile for the camera? Are you going to smile for the camera? Hey? Hey, do you want to do scratch? Want to do scratch? You want to scratch? Are you going to eat my hat? Are you going to eat my hat? Who do we accept referrals from? Well, at this point in time, there's only a couple of referral models where we will require a referral. So one of those is Work Cover Queensland, where we require a valid GP referral. So we can do adjustment to injury counselling. So as long as you've got an open work cover claim with a claim number, we can do, an initial kind of 6 sessions and then take it from there. We are looking to kind of partner with different organisations to run a few kind of pilot programs where we can either look at, this as a therapeutic outcome or this in comparison with another outcome, and see if we can kind of join those together and what outcomes we may get from that. We obviously are doing accepting and we can take open referrals from yourself, so you're welcome to just book in. We are looking to do a bit of travel, so I guess within around an hour and a half of our location, we can travel for a minimum of 5 clients, just to make it, I guess, something that everyone gets benefit from, without having to bill travel as well. So that might look like where we take a couple of little kids and we hire a facility. If you've got something near you, and a few people that you think might benefit and can arrange, or we are doing some sessions where people can bring your own horse. So we may book into a pony club grounds or a show grounds or something like that, and people can bring their own horse, and we can show you exactly what it's about through the use of your own horse. How many sessions do you need to book in for? Look, the average kind of program is around 10 to 12. The whole kind of thought process of counselling is that we are aiming to put ourselves out of a job. So we don't really want to set people up where they're having to come weekly for a year or 2 years. If that's what it takes you, that's what it takes you. But the benefit that you can get from equine-assisted therapy usually is kind of achieved over around 10 to 12 weeks. Which is why I guess it's so impactful. Hey, it's so impactful. Oh, it's so impactful. It's so impactful. So